Hi everyone, and thanks for joining us again for this episode of Facebook Live. We're going to actually start out our episodes a little bit differently with a Trivia Tuesday question. With this Trivia Tuesday, we will be drawing a winner from every Facebook Live. We'll compile the ones for the month and then draw them at the first of the month. So this being our first one, it may work a little bit differently this time, but if you like freebies and you like trivia, be sure to tune in every Tuesday at 4. So today, if you'd like to be eligible for our drawing, you will need to like this video, share it to your own Facebook page, and comment your answer to this question in the comments below. And the question is, what is the smallest bone in the human body? So, I know, it's a real, no Googling, no cheating. Just kidding, you can cheat if you want, we won't know. But, so like I said, every Tuesday we'll do Trivia Tuesday at the beginning of our Facebook Lives, and you'll be eligible for a drawing if you do 3 things. Like this video, share it to your own Facebook page, and post your answer to the trivia question below. And the question is, what is the smallest bone in the human body? All right, well, we'll keep this live for 24 hours. That way you can answer in the comments below. And if you do put that in there, we'll like it to make sure that you know that you're eligible for the drawing, so you can tune in, and we'll post when that drawing will be. So, well, thanks again for joining us. My name's Regan, and this is Karen, and we're going to talk a little bit about a symptom, really, that can be caused by a number of reasons. So, tell me more about vertigo. What is vertigo?
Vertigo is a false sensation of movement or spinning. So you would be stationary in the room and the room would be spinning around you.
Awesome. Well,
yeah.
Not awesome.
It's not really an
not
awesome
awesome thing.
Sure.
Right.
If it's you, it's not awesome.
Right. So tell me more about the symptoms and what maybe some of the causes are.
Sure. So there are really different types of causes of vertigo and dizziness. So true vertigo is something that we consider BPPV, and that's an acronym for a really long word that I won't go into, but it's one of the most common causes of dizziness. That can be caused by multiple different problems. One is changes in medication, a sinus infection, sinus health, changes in that. If you're dehydrated, you can get symptoms of vertigo. If you've had a cold, if you've had any head trauma, those are all symptoms of true vertigo, and that would be diagnosed by either your physician or by a physical therapist.
Right. Is this something that is an ongoing symptom that you have, or can it come on periodically?
It can definitely come on periodically, so it can be treated. So if you see your physical therapist, it would be diagnosed and then it would be treated, and there's really no cure for that, but there are definite treatments for it that can really help. And if you're the person that's going through this, it is life altering. You can't look up, you can't look down. Sometimes position changes in bed will cause it. So it's really important to get that looked at and get it taken care of.
Right. For those of you who are just joining us, thanks for taking time out of your Tuesday. We are talking a little bit about dizziness and vertigo and some of the causes of that and how we can treat it with advanced and preferred physical therapy. So what occurs to your body when you have true vertigo or BPPV?
Okay, so what happens is you have little crystals in the ear. They're calcium carbonate crystals, and they become dislodged, and they end up in what's called your semicircular canal in your ear. So it's in your ear. It's a very small, it's a very small part of your body, but it can become dislodged. And your vestibular system is what keeps us, you and me, basically on a level field. So it's what allows us to know where we are in space and to be able to stand upright, to walk upright. And if your vestibular system is compromised, then and those crystals become dislodged and they end up in those semicircular canals, then what happens is you have this false sense of what's going on, and the room can be spinning. So
that would be really, really hard to live with.
Yeah, it is. And most of those patients that we see at both advanced and preferred, those are immediate, get them in. So if you're having those symptoms and you contact the clinic, you would need to just let them know that I'm having dizziness, I need to get in as soon as possible, and we work those patients in.
Yeah. What are other diagnoses of with symptoms of dizziness or room spinning or anything like that?
Sure. So the room spinning is the true vertigo, like we talked about, or the BPPV. The second most common cause of dizziness is actually what we call cervicogenic dizziness, and that means it's coming from the cervical spine or the neck itself. So that can be from tight muscles, it can be from your joints not moving well, it can be from posture, and we talked a little bit about posture a couple of weeks ago and the importance of that. So that can also come on if you've had a whiplash injury or any sort of head trauma, or if you have severe arthritis.
Goodness.
So we look at the neck, and we always evaluate, when a patient comes in, we always evaluate the neck and make sure that there's nothing else going on, make sure that there's no vascular compromise, and make sure that it is true dizziness or vertigo that's associated with the vestibular system or the neck itself. So we can treat both of those in the clinic, which is pretty awesome. It's a subset, definitely a specialty of physical therapy, and we have clinicians that can treat that company-wide. You just have to contact the clinic to make sure that someone can accommodate you.
Right, and if you have questions about whether or not your clinic treats these different diagnoses, you can always call us at our 866 number, which we'll post below, or call your clinic and just ask the receptionist at the front desk, and they can point you in the right direction. We do have a question from Whitney. Whitney would like to know, I experience periodic dizziness. At what point should I consider it bad enough to come into therapy? So maybe we walk through what you should do if you have symptoms, and when you come in, and then what that looks like from there.
Sure. So you can get dizziness from a lot of different reasons. Like I said before, you can be dehydrated, you can have had a cold, you can have an infection, all of those things. So those are things that you would look at, with your physician or even with your therapist, and try to figure out, well, have I changed my medication? Am I drinking enough water? Am I dehydrated? And then at that point, if it's impeding your function, which we've talked about before, physical therapists are all about function. So if you can't do your daily activities, if you can't do what you need to do every day, get up, drive your car, walk to the bathroom, those kinds of things, then it's impeding your function to the point that you need to absolutely do something about it. And physicians will refer, some inner ear doctors also treat this, but a lot of times they refer out to physical therapy, and we have good relationships with those physicians, so they refer to us, and usually it'll take just a couple of visits, especially if it's that true vertigo or that BPPV. It'll take a couple of visits to get you back on your feet again, so to speak, and get you back on track. Sometimes it takes a little bit longer if it's been more of a chronic condition. It can take up to 4 to 6 weeks, and then that's when we employ balance training and eye tracking exercises. There's lots of exercises that we give for that, and it's actually really, really powerful, because you go from not being able to function to being back on your feet again, which is super important if you're the person, if you're the patient.
Right. So one thing we've talked about in previous videos is that every time you go in for an evaluation, your symptoms are going to lead the evaluation. So can you walk me through what an evaluation would look like with this?
Sure. So when you come in, we would ask lots of questions about your recent medical history, any changes in medication, any changes in hydration, if you've flown, those kinds of things. A lot of times if you've been on a plane, you're more apt to be dehydrated, if you've had a cold or any sort of a sinus infection. And so we would start there and determine all of that first, and then we would start with the head and neck, and we would make sure that there are no other issues going on. Like I said, that the vascular system in the neck is intact, and if once all of that is cleared, then we would go through neck range of motion and make sure that everything is good on that end. And if with any of that you get that dizziness, then we'll take you through a series of basically positions to see if we can elicit that dizziness or that vertigo. And if we can elicit it, that's the goal in therapy, is to be able to elicit that. And it's not a comfortable feeling, because if that room is spinning and you start to feel nauseated, it is not a good feeling. But we really need to be able to determine if we can elicit it. If we can, then we can help you. So what we can do then is we can do a repositioning technique. So it's a series of rolling from one side to the other, and the therapist guides you through that. To basically reposition those crystals back in the right part of the inner ear. So, yeah.
It's crazy that this is something that we can treat.
Yes.
It's amazing, too. So, do you have anything else that you want people to know about vertigo, dizziness, anything that comes in that little package?
Sure. There are other causes of dizziness as well. One cause is if you have a central issue, meaning if you have an issue with your brain or your spinal cord. Patients that have had a recent stroke or a transient ischemic attack, a TIA is what they're called, or multiple sclerosis, MS, those patients sometimes will have dizziness symptoms. So those are usually more of a central origin, meaning it's from the brain or the spinal cord. So we would just want to rule that out, and then we can do balance exercises for those patients as well.
So there's lots of different options.
There's lots of different reasons that patients would have it. And another one is if your vestibular system is what we call hypofunctioning, so it's not functioning up to par. And a lot of that is caused from an infection. So, I mean, we can't treat the infection. Obviously, we would send you back to your physician to be treated for the infection if that's what we think is going on. But yeah, there's lots of reasons that you could have dizziness.
Right, and it's our job to get down to the root of what it is.
Absolutely.
Along with your doctor to try and fix that problem. So, Maribel would like to know, should we take our dizziness medication before we go into an evaluation?
Generally, I would say no. And the same as pain medication, generally we don't want you to take a pain med before you come to therapy or a dizziness med before you come to therapy, because we want to be able to see what exactly is going on. What we will be looking at is how your eyes track with different activities and different movements, and we want to see if we can elicit that nystagmus or that eye tracking, the beat of your eye when we're doing those positions. So generally no.
Before an appointment?
Before an appointment.
Okay.
Before a physical therapy appointment, especially if you're going to come in for the evaluation.
Right.
Now, if you can't function to get there, you probably need to take it. But generally, if you can make it to therapy for the evaluation, I would say no, don't take your medication.
Definitely. Well, I think that's all we have for the topic, unless you have anything else to add.
No, it's a really powerful experience if you're the one that's experiencing the dizziness, to be able to come in and be evaluated by one of our therapists, and it's a game changer in terms of quality of life. So if we can get you some exercises and get you back on your feet again, that's our goal, and that's the best thing. So just give us a call if you have any dizziness or vertigo.
Yeah, and like I said, we will post that phone number below. So if you have any questions, feel free to drop them in the comments below. But if you'd like to talk to a therapist or someone about these problems and maybe get an evaluation scheduled, we do have the Contact Us form on our website, or like I said, you can give us a call. So thank you, Karen.
Yeah, you're welcome.
I appreciate you
Thanks
coming on again. Before we go, I just wanted to remind you that we are doing Trivia Tuesday. The trivia question is, what is the smallest bone in the human body? So please drop that answer below, and you'll be entered for a drawing, to win a drawing, a little gift basket or something that we will have for you. And then the other two things that we need you to do for us are share this video and like it as well. So thank you again, and we'll see you next Tuesday for another topic, and have a great week.
Thank you.